Muscle tone is the typical resting length of muscles in a person's body. It is defined as resistance of a muscle to stretch. Here we have our therapist, Barbara, who is going to be testing Krista for muscle tone in the upper extremity.
Okay, hello Krista. I'm going to be testing your muscle tone from your head all the way down to your fingertips. And Krista is a normal patient. And we're going to start off with cervical, lateral flexion. Good. And now flexion and extension. Good. Now shoulder flexion, bring all the way up and back. Extension. Good. Now out to abduction, and then across the body for adduction. And now we're going to external rotation and internal rotation. Bring your arm down. And now we're going to bring your arm up and down and up. Good. Supination, pronation. Now wrist flexion and extension. And finger flexion and extension. Okay. Now we're going to test Samantha, who is a abnormal patient with a dysfunction, and she has hypertonia. And so this means her movements are less fluid and they're more rigid. So we're going to do the same motions again, starting from your head down to your fingertips. And cervical lateral flexion. As you can see, it's harder to move, and she's not as fluid as our other patient. Forward and back. Good. Now, shoulder flexion. Oftentimes the full range isn't there. And extension. Good. Abduction. And across the body for adduction. Good. Back here. Now, then bend at the elbow. External rotation and internal rotation. Elbow flexion and extension. Wrist flexion and extension, and supination and pronation, and finger flexion and extension.
Dysfunctions in upper extremity tone can cause either hypo or hypertonicity. Neurological events can lead to this, such as
Upper or lower motor neuron lesions.
Or a stroke or a seizure.
Thank you.